We've talked in the past about trying to control pain after surgery using multiple different medications. Let's talk a little bit about one class of medication that can be very helpful that I think you should know a little bit about. NSAIDs, or non-steroidal anti-inflammatory medications, are used frequently in the postoperative period. There have been some studies recently, one in particular, that highlight the value of NSAIDs after surgery. There was an article in the Spine Journal, which is a leading journal for spinal care, explaining that toradol, or ketorolac, is a drug that can be used in the first 48 hours after spine surgery without increasing the risk of surgery. In the past, people were worried that toradol would increase the risk of bleeding after surgery, and they were also worried that toradol would decrease the fusion rates after a fusion surgery. And this particular randomized trial demonstrated that the bleeding rate was not higher and the fusion rate was also the same or not any worse compared to not using toradol. We really like using toradol in the postoperative period because it decreases the use of narcotics, which cause some other problems, and it also can decrease the length of stay in the hospital. Another medication that we like, which I think of as an extension of the IV toradol given in the hospital, is Celebrex. Celebrex is a selective non-steroidal anti-inflammatory. It's easier on the stomach than, say, ibuprofen is, and Celebrex can be very helpful in management of pain after surgery. We usually recommend Celebrex to be taken in the morning and at night, or twice a day after surgery, and typically patients take 100 milligrams, but in some cases can bump it up to 200 milligrams. Patients that have kidney issues, especially if the creatinine is more than 1.5, should probably avoid the use of NSAIDs. One final caveat: if a patient has a fusion, we usually want to use the NSAIDs for about 2 weeks and then use them only sparingly afterwards. The reason for that is there is some evidence that high-dose NSAIDs for an extended period of time can decrease the rate of fusion, and we want to avoid that, obviously. A lot of patients run into a scenario where they use diclofenac or naproxen or Celebrex or another NSAID regularly. They take it after surgery for a short period, and then we recommend that they stop taking it for a while, and their pain is difficult to control because it's effective. In that situation, I say the risk of the NSAIDs affecting fusion is low, so use the medication, but use it sparingly. Use it when you feel like you really need it and not in a scheduled way. After several months and we feel like the fusion is progressing, it is okay to resume the NSAIDs.